Okay, we have right here the anterior view of the heart. The sheep heart is plastinated, and also we can identify the main sulcus. We have the anterior interventricular sulcus run diagonally, overlies the septum, the interventricular septum, and we have also the presence of both lower chambers. So this is the right ventricle, and this is the left ventricle. As you can see, the muscle is thicker in the left ventricle. Then we have the opportunity to identify the main blood vessels. This is the first one, the very most anterior blood vessel, that is the pulmonary artery. You can identify the pulmonary artery right here. And right behind, we have the aorta. The aortic arch gives rise to different branches, the brachiocephalic and the left subclavian. In human, we have three. It's brachiocephalic, left common carotid, and left subclavian. Then we have the superior vena cava. Superior vena cava that ends up into the right atrium. So we have right atrium, is the upper chamber on the right, and we have the right ventricle, the lower chamber on the right. On the other side, we have the left atrium, and also we have the left ventricle. You identify quite well in this section, we have part of the pulmonary veins. So pulmonary veins that drain into the left ventricle. And also, we are able to identify in the posterior view the posterior interventricular sulcus. Posterior interventricular sulcus that divide the right and the left ventricles. What else? If you identify quite well in between the right atrium, right ventricle, posterior section, the coronary sinus. This coronary sinus drain into the right atrium. Of course, deoxygenated blood, all the waste material that came from the entire heart. Now, when we visualize again the anterior view, we are able to identify main branches of the coronary artery. The first one is the interventricular coronary artery, the branch of left coronary artery that's located right behind the pulmonary artery, and also the circumflex that surrounds the entire left side of the heart, ends up in the posterior section and feed the entire left section of the heart. In the right side, we also are able to identify some branches, those branches that we have right here. Those are marginal branches. Marginal branches that branch off the right coronary artery. Right coronary artery branch off the aortic arch. And then in the posterior section, the right coronary artery that surrounds the entire right side of the heart ends up to the last branch, the terminal branch, that runs through the posterior interventricular sulcus, that is the posterior interventricular artery. Again, branch of right coronary artery. Finally, the location of the heart, the pericardial cavity, mediastinum, and in the inferior section, you take a look, we have the apex that points down, run diagonally, it will be tilted to the right side. Thank you.